Lush, a board-certified OBGYN physician with over 30 years of clinical experience. Let's talk today about postmenopausal bleeding. So, once you're in menopause, either a year without a period or getting diagnosed with a blood test, average age is 51, then you shouldn't have periods anymore. And if you do, if you have any sort of vaginal bleeding, you need to notify your doctor. And generally speaking, it's not serious unless you ignore it and go for months or years not paying attention. And then there could be something that's potentially dangerous. The biggest risk is uterine cancer or endometrial cancer. The good news is that if you get it addressed a reasonable amount of time and don't ignore it, then you're going to be in good shape the majority of the time. Generally speaking, if you have that, then we want to know if you're on hormones or not, and when you went on to menopause, and whether you have other conditions. So some of the risk factors for having precancer of the uterus or even cancer of the uterus are being overweight, diabetes, and long periods of time of what's called unopposed estrogen. So that's estrogen with treatment without progesterone treatment. Those two hormones kind of balance each other out. So if you're sent to a gynecologist with postmenopausal bleeding or bleeding after menopause, then you're generally going to get an ultrasound, hopefully before you get to see your physician. And we want to look and see if you have some growth, polyp, or a fibroid, which is also called leiomyoma uteri, which is a non-cancerous tumor that 70% of women have of the uterus, or most of them are non-cancerous. They're very common. 70% of women age 50 have those. And also to see if the lining of the uterus is thickened, because once you are in menopause, generally speaking, it should be below 4 millimeters. That cutoff has changed over the years, but it should be thin. If it is thin, maybe you had a bacterial infection or some other reason and it wasn't coming from your uterus. But generally speaking, you'll get an ultrasound. You might get a sampling of the lining of the uterus, which is kind of like a pap smear, but instead of using a little brush that goes in your cervix, we use a little tube that goes a little bit further. It can cramp some. Rarely is it really uncomfortable, but on occasion it is. So if you're going to the doctor and you anticipate that, it might not be a bad idea to take Advil, ibuprofen if you're able to. You get that test, and then oftentimes that test only samples 4% of the lining of the uterus, and we need to know about all of it. And the reason is we're looking for precancer of the uterus, which is called endometrial hyperplasia with atypia. That's the technical term. But if you have that, then there is a 40% chance with today's studies that suggest it would turn into uterine cancer, and generally the recommendation would be to get a hysterectomy. That depends on your overall health, your particular condition. Let's say you're not a good surgery candidate, you have multiple other health problems, then there are some medicines that could be temporizing, but generally speaking, that's the recommendation. The endometrial biopsy only samples 4% of the lining of the uterus, and we need to know about all of it, and that's why we often recommend a hysteroscopy, DNC. Hysteroscopy is where you're asleep and you put a little camera inside the uterus and look around, and the DNC, dilatation and curettage, is to scrape it all out and send it to pathology. Very simple surgery, minor risks. All surgeries have a risk of bleeding, infection, anesthesia. That depends on your other risk factors, injury to adjacent organs. All those risks are really low, but they're never zero. And review those details tailored to you and your specific risk factors and your specific scenario when you discuss with your doctor. So this is a general overview, maybe give you an expectation of what will be addressed, what might be going on. And the good news is, if you don't delay and get your intervention soon, you should be in good shape. We're always happy to hear that women have said, oh, I just started this. And we're more concerned when a patient says, yeah, I went years without a period, and then I started bleeding every few months for last 5 years, but I didn't think it was of concern, then we're certainly much more concerned that something more serious is going on. I hope you found this helpful to give you a little bit of background and understanding of what to expect if you're going to be going to your doctor, or as a review if you've already spoken with your doctor. Thank you.